And at the same time, we're seeing the toll that heroin and other opioids are taking on Buffalo's suburbs. Here are the areas with the most opioid overdoses. The latest numbers from 2014 show 21 people died in the town of Tonawanda, 18 people died in West Seneca. Hamburg, Lackawanna, and Cheektowaga each had at least 12 fatal overdoses.
2 weeks after his office closed in Williamsville, thousands of Dr. Eugene Gosy's patients are still left without any treatment options. The doctor is accused of giving out thousands of illegal prescriptions.
The closing of his office has cut off patients from their opioid prescriptions. And News 4's Marissa Perlman spoke with an addiction specialist on the ground floor of this public health crisis. She has the story from Buffalo.
Just a few days before Dr. Gosy's office is expected to open, we're hearing from both state and local leaders that they're trying to deal with this crisis here in our area.
I would say fear is a big part of this.
Dr. Paul Updike says fear is at the center of this opioid epidemic here in Western New York.
There's fear on the sides of the physicians. There's fear on the sides of patients. What happens if I don't get these medications? What happens? Why won't people help me treat my pain?
He runs the addiction clinic at Catholic Health and also a methadone clinic in Buffalo. He's someone that's seeing this public health crisis firsthand.
I see that it's already been a struggle for a lot of these patients. Frankly, whether you have the disease of addiction or serious chronic pain problems, it's already been difficult for any of these kinds of patients to get proper help in this community.
After Gosy's office closed, his more than 10,000 patients who are dependent on painkillers are struggling to find a new doctor.
There is concern amongst physicians that if they try to help some of these patients, that they would be in trouble, so to speak, from a regulatory perspective.
Updike says there was already a lack of treatment options for addiction and pain management before his office closed. He says this expedited this problem.
This was like the straw that broke the camel's back.
But these doctors' concerns have been in place for a long time.
These are attitudes that have been brewing in this community for a while, I would say.
But Updike says there has been a response from the medical community. Doctors are now working to expand access to other pain management physicians, although that's limited. Updike is also trying to educate primary care doctors about how they can help a patient already on opiate therapy. That's in hopes they can help in some way. Reporting in Buffalo, Marissa Perlman, News 4.